Hi, I'm May Yam. I'm a raw meaty bones vet at Blythe Park Pet Health Centre. Today I'm going to talk about skin and ears problem in dogs and cats. It is now November, so in Australia we're in spring stepping into summer. And this is now also the peak season when we see skin and ear problems and disturbances in dogs and cats. Now these are broad problems, but they've got a consistent theme. These are common and they are repetitive in nature. They're very stubborn to treat and they become chronic fairly quickly. And it is just frustrating as a problem. In this video, we aim to equip you with the basic skill of how to detect these problems early. Discuss what happens if it is left untreated. Touch base on the topics of allergies, and the area that I'm most passionate about is how does raw meaty bones improve conditions for dogs and cats for skin and ear problems. Let's talk about recognizing the problem early. Let me show you how I examine a pet here in the consult room. First of all, look at your pet at a distance. What is he or she doing? Is she itchy? Is she chewing? Is she scratching? Is their head shaking? Or is she dragging her bottom or her belly on the grass just to get some relief? This is going to tell us where the itching spot is or the infection is. So once we've got them nice and close, let's have a closer look. What you're looking for is if there is any redness, swelling, any red raw lesion, any flaky skin, crustiness on the skin, or any oozing, for instance. With the ears, I'll peel them back to have an examination. Now the ears needs to be nice and pale pink, free of smell. Bit of wax, bit of discharge is normal, but excessive does indicate infection. It certainly shouldn't be moist. Sometimes when you manipulate the canals, it can sound like there's some fluid in the ears, and that's abnormal. If you've got dogs with very fluffy ear canals, make sure you part it to have a good look or go closer to it and smell it. Now, smelling is a very informative way because ear infections does smell. And if there is a foul smell coming from the ears, you need to get them examined at the vets. And one more thing that gives you clear information as well is if your pet reacts in any way when you're examining the ears. They typically are nice and pain-free, but if they're dodging away, oh, don't touch me, in pain, or they are trying to turn around and even give you a little nip, that can mean something. It means that they're in pain. So there are factors to think about as well. If they're giving you that reaction, better to take them to the vet soon. Now, let's have a look at its mouth, because bad teeth predisposes to bad skin and ears. Now, having a look in the mouth, making sure that there's no plaque and calculus, and peeling the lips right back to have a look, have a good examination. This examination tells me what diet is the pet on and what degree of periodontal disease there is, and subsequently, what sort of stress does it put on the immune system of the patient. Now let's have a look at the body and examine the skin. Now, having a closer look, I like to run my hands all over the body, nice and close. Have a feel of the coat. Is it greasy? Is it flaky? Is it dry? And part the hair to actually having a look at the skin. So come right close to the patient and just part the hair as you go, because quite often there may be rash or pustules once you part the hair to see, because the pathology is often on the actual skin that's covered by the hair. Now the pathologies are easier to notice on the abdomen because it's more bold and the hair is more sparse, but with the dorsal part of the body on the back, you want to see nice and close. And where are the rashes? Is it just around the base of the tail? Or is it all the way along their back? Or is there a lot of rashes or redness all underneath the belly? And discolorations in the paws are common. And for brachycephalic breeds, right in their facial folds, around the eyes and nose are very common locations that have problems. So have a good look at all these places. Have a good feel and have a good sniff as well. It's the same thing to ears again. When there's a bad smell, it is not right. If you're concerned about your pet's skin and ears health in any way, here's what you can do. First of all, the obvious things need to be seen. For instance, if there is severe itchiness, severe discomfort or pain, they need to be seen sooner than later. Second of all, if there's only a mild itch or rash and you just wanted to see and observe the progression of the disease, you can do that. Give it a couple of days and see if it goes away. Third of all, general guides to come in sooner than later would be oozing, smell, bad smell, and red raw lesions. If you think that the rash or itch is fairly mild, you can observe at home to see if there's a progression for a couple of days, 1 or 2 days, 3 days, 4 days, as long as it's not getting worse. And if it goes away, that's great. If it doesn't, don't wait for too long, because once it becomes chronic, it becomes a challenge to treat. Once you bring your pets into the vet clinic, we have got otoscopes to have a look at it closer and with the help of a microscope, and we even can be clipping up the patient so that we can see it even better and treat it better.